Good afternoon, everyone, and welcome to the Michigan Vaccine Project webinar on chickenpox and shingles. My name is Maggie Magoon, and I'll be the moderator for today's webinar. I would like to start off by introducing Katie Stanulis as our speaker today. Katie is a family nurse practitioner with the Sparrow Medical Group in East Lansing, and she's certified as a family nurse practitioner through the American Association of Nurse Practitioners. And she has been practicing family medicine and urgent care medicine in the greater Lansing area since 2015. Prior to her work as an advanced practice provider, she spent 9 years providing inpatient care as a registered nurse at Sparrow Hospital. Katie's clinical interests include all aspects of primary care and family medicine. So welcome today, Katie. Is there anything else you would like to add to that?
No, thank you. Great introduction. I'm glad to be here.
Great. And before we dive right into the questions, I have included 2 links in the chat. One is a diagram on dermatomes that may help during some of the questions. And then there is a link to the evaluation. We encourage you to complete that at the end of the web. Let's get started with just some background information. Katie, how does chickenpox relate to shingles and how are they connected?
Yeah, that's a great question. Chickenpox is a virus that we commonly associate with childhood. It's actually the chickenpox virus. After we recover from the acute infection, that virus lies dormant in our spinal column for forever, for years and years. And then later in life, typically later in life, during often periods of acute stress or illness, that virus can erupt, and that is actually shingles. And shingles is you mentioned that dermatome map, which I'm glad you mentioned because it's a good visual to have. And it typically follows like a nerve pathway pattern and is a really painful blistering rash. So you can't get shingles unless you've had chickenpox infection at some point in your life. So that is how they are connected.
And I know that people have asked me questions about that and the overlap or interconnection of those. And I know there's some questions about that as we progress. So is there anything you can do to prevent chickenpox?
Yeah, the best thing we can do to prevent it is a chickenpox vaccine, which is part of the routine CDC childhood immunization schedule that's available. We start, I think it's at 12 months we do the first dose for that one. So that's really our best.
And that's good to know now because that wasn't around when I was a kid, for instance, and several of the team members and participants. When we were kids, it seemed like everyone got chickenpox and it wasn't necessarily a big deal, but can it be a big deal? And do we really need to get that vaccine against it?
Sure. Yeah, that's a great question. So yeah, especially for healthy kids, chickenpox can be a mild to moderate illness that maybe doesn't seem like a big deal, but it certainly it still has a significant burden as far as time away from school and then passing that infection on to other siblings or household members, and then the trickle-down effect there too. There are some more rare, pretty serious complications of chickenpox, including like meningitis. It can be fatal. That's much less common, but yes, it is more than just an mild illness, and so it is important to get vaccinated.
And you just never know when that rare side effect could. So just as like insurance against that possibility of getting those vaccines.
Yeah, it's a good way to explain it.
We'll go back and forth a little bit. There's a question too, since they're so interrelated, what then can you tell us about shingles and some of those symptoms and who's at risk?
So like I mentioned before, that chickenpox virus stays dormant. It lives within our spinal column. And then shingles is actually when that virus re-erupts. And it follows this typically a nerve pathway pattern, often on the trunk, often one-sided. And it's this really bright red, angry, painful, blistering rash. And it's the pain, from what I understand. I haven't experienced it personally, but I've taken care of plenty of patients who've had acute shingles. It's that like burning, shooting nerve pain, which is incredibly uncomfortable and very hard to treat. So it typically presents in older persons, like 50 and older, and that's often just because that age group has more chronic conditions, maybe immunosuppression due to some other condition or medication, or just as part of the natural aging process, the immune system is not efficient as it once was. So they're more likely to get this infection. And the acute rash itself is pretty miserable and awful. And we have to be careful to keep it covered, and because it is contagious to somebody who's never had chicken pox or hasn't been vaccinated against it. So as long as you have those blisters until they're fully scabbed over, you can be really contagious. And then like in a hospital setting, we take extra precautions, because if we have a patient who has acute shingles and they're immunocompromised, they can actually spread that virus through respiratory droplets. So we take some additional precautions with masking and gowning, because then obviously it's not just touching the fluid or the rash itself.
Okay, that is really good to know. And I know that people have experienced that. We'll tie back in a few questions to that later to get more details on that too. Often, as you mentioned, shingles is thought of as more of an elderly disease and chickenpox is young. So can children though get shingles right after they get chickenpox?
I think that would be pretty unlikely. I'm not an expert in the disease course per se, but typically there, maybe not shingles, but there are some cases of kids that have had more than one case of chickenpox in childhood. Typically the second one is much less severe, but to my knowledge, no, not shingles in children.
Okay. Yeah, my brother actually had shingles some time after he had chickenpox, and I don't usually hear of that. Maybe it was just another case of chickenpox. I don't know. So on the other side of that, then, can adults get shingles after being exposed to a child who has had chickenpox?
So, no, not shingles, but if there's an adult who has never had chickenpox and they are exposed to a child who has acute chickenpox, then they are susceptible to getting chickenpox. So it's kind of like you can't put which came first, the chicken or the egg, right? So, you have to have the chickenpox virus first before you could have shingles.
And as you mentioned, then later that erupts. Yeah, okay, that's good to know. Good to know. So when do you get the shingles vaccine? We talked about some of the age of most vulnerable people, but what is that normal age, number of shots or series and time between that's recommended?
Yeah. So the best vaccine that's available right now for shingles it's a 2-shot series that's spaced out by 3 to 6 months. And it is routinely recommended for all adults aged 50 and over. And then for adults younger than that, in the 18 to 49 age range, it is recommended if they have any immunocompromising conditions or are on medications that would cause decreased function of their immune system.
Okay, and is there a time recommended between that 2-part series?
Yeah, it's 3 to 6 months.
Or did you already mention that? Sorry if I missed that.
Okay.
Okay. All right. So I have a question from a participant that said, my mom recently had shingles and I would really like to get the vaccine, but I'm in my 40s, said I'm not eligible. So why is that? Why is it that it's just routine when you're 50 and above, unless you're immunocompromised? So why can't you get it earlier?
Sure. So I think that has to do with kind of the natural course of shingles in healthy adults. So people who don't have immunocompromising conditions, when they did the research on the shingles vaccine, they found that there was the most benefit versus risk starting at that age range. And the idea is to get that on board ideally at 50 or in your 50s, right? Before you're reaching your 60s, 70s, 80s, when your overall immune system starts to decline and your risk of shingles infection goes up.
Okay, great. Good to know. So also, obviously, if there's any question or you may be immunocompromised, talk to your primary care provider. And yeah. Okay, so we have a few questions, and I know there's concerns about side effects of the shingles vaccination. So we'll talk a little bit about actually getting the vaccine. And I know that I have gotten it now, and it wasn't the most pleasant vaccination, but well worth it, and for me anyway. So can you talk a little bit about the possible side effects for the shingles vaccination and how the side effects can be managed?
Absolutely. Yeah. So with any vaccination, there's possible side effects. The top 2 are always like pain at the injection site or redness at the injection site. And that's really common with any vaccine. Maybe a little bit more intense muscle pain, like we see with tetanus shot. I know we don't get the tetanus shot too often, but that one is known. I always tell people that you're just going to feel like you got punched in the arm for a day or 2, and then you'll be fine. So yeah, it can be painful, but from what I don't fall into I haven't had a shingles vaccine yet, so I don't know the experience personally. But from what I've heard from my patients is how I like to describe it is that it causes a pretty robust immune response, especially the younger you are, the closer to 50 when you get it. Maybe feeling a little run down, maybe having a little low grade fever, achy, that sort of stuff. I hear that from patients as their experience. But I'll tell you that I can't think of one patient that didn't go back and get their second one based on the experience they had with the first. So that's reassuring. So ways to manage that. So the pain itself, just like we would treat any sort of muscle or soft tissue injury, like ice or heat, Tylenol or ibuprofen, if that is safe for you, just gentle, staying well hydrated. That's always going to help flush out any lactic acid buildup there in the muscle. And I think too, knowledge is power. If you're going into it that I heard that I might be a little sore. I heard I might feel a little run down. I think people are better prepared to handle those maybe side effects that are deemed unpleasant. The other thing that I often will recommend is that the timing of the Shingrix vaccine. So especially if it's somebody who's working like full-time still, that maybe they consider scheduling it on a day, like a Friday afternoon on a weekend where they don't have a bunch of plans, so that if they do feel a little run down, that they really have time to rest and recover and not feel like they have to slog through their workday feeling really crummy.
So what might you say to someone who maybe had a reaction that was not less than pleasant on that first shot and might not want to get it, or just might not want to get it at all, and say, is it really worse to get shingles?
Yes. And so I think what a lot of people, so shingles itself, like I mentioned before, with that terrible, painful, blistering rash, that piece of it itself is pretty miserable. And that piece of the infection lasts somewhere in the 7 to 14 day range. But what I think a lot of people don't know about shingles is, one, sometimes it lasts longer than that. That nerve pain is just really unbearable. And even with all the tools we have in our toolbox as providers, it is really hard to treat and really hard to get it under control. And then there's also something that's associated with shingles infection that's called post-herpetic neuralgia. And what that is, chronic nerve pain in the same nerve pathway that they had the actual shingles rash. So sometimes that can last for months or even years after the acute shingles infection. And it can be incredibly, again, hard to manage, pain control wise, and really just affect the quality of life overall. So maybe to somebody who's just had the vaccine and feeling crummy with the side effects and dreading the next one, if we're talking about a day or two of feeling down twice, months and months of terrible, debilitating pain, I would take the former. And that's another one of the great things about the shingles vaccine is it prevents the eruption of shingles, right? So the acute shingles infection, but the data on how it prevents the post-herpetic neuralgia, that chronic nerve pain, is phenomenal. It's 80 to 90%. It's really good, really good.
That is fantastic to know. I know we have, like I mentioned, a team member who has had it, or parents that have it, and we'll dive into that a little more in a minute. We had a question though from the audience about you're talking about how you talk to your patients. Have you seen that most doctors are aware that over 50-year-olds need that shingles vaccine? And because this person, when they went in for their physical a few years ago, the physician did not mention immunizations.
Gotcha. I can speak to my clinical practice and within the Sparrow system. And so should providers know that immunizations are recommended? Absolutely. Are some better than others on keeping up at current guidelines? Probably. We're fortunate enough to have a really great electronic health record that has a lot of safeguards, and we call them care gaps, where we get these bright red alerts that are right in kind of the patient demo section of our chart that'll say that automatically calculate based on the patient's age, and also sometimes with their medical conditions, what immunizations and other screening tests and stuff that they would qualify for. So for me, I know that, yes, that it's recommended for age 50 and over, but also I have that big reminder, and I don't save it for a physical. I talk to my patients about vaccines every single time they come in the office, because it doesn't, oh, you came in because you hurt your ankle? Guess talking to them about vaccine because it's more, not everyone comes in for an annual physical anyway. So we got to catch them.
And that's part of what our educational series is about too. Even if your physician doesn't necessarily, or your healthcare provider doesn't mention it to you, to try to advocate for that. And so providing all of this information will hopefully encourage people to advocate and ask about the vaccinations that they do need and when they need them.
Yeah.
So touched on this a bit about shingles being contagious. So one of the questions, there are a couple of questions that go along with that is, if you're pregnant, should you stay away from someone who has shingles? And then if you do get it, how long should you stay away from work?
Sure. So I'll start with the question about pregnancy first. So the concern is there that the chickenpox virus can cause complications to baby in pregnant moms. So that's why it's concerning. So if a woman is pregnant and she has never had chickenpox or not had the chickenpox vaccine, then yes, she would be susceptible to getting an acute chickenpox infection if she had direct contact with a family member that has that open blistering rash. So if that's the scenario, that she's not had the vaccine or ever had chickenpox, it certainly would be best to stay away. And then as far as how long you're contagious, so I know that shingles is that blistering, it's like fluid filled little blisters. And at some point they open up and drain, and then they'll crust over as they start to heal. So you're considered acutely contagious until those blisters all are dried and crusted and healed over. So generally we recommend that people just keep that area covered. So these are like not immunocompromised individuals need to just keep the area covered. So basically, if you keep clothes on and the fluid's not like weeping through your shirt, you don't necessarily, then you can carry on with your normal activities. You don't have to isolate like we've been doing with COVID, right? So yeah, but you're considered no longer contagious once all those vesicles are crusted over.
And so that's important too, to that pregnant mom that should isolate away from someone until those blisters are gone. So on a side question to that, if you're a pregnant mom, you haven't had chickenpox or the chickenpox vaccine, can you get the shingles vaccine while you're pregnant, and would that protect you? I guess the likelihood of being over 50 and being eligible for the vaccine and being pregnant might be
really slim. Yeah, I'd have to look at the guidelines specifically, but I don't think that the shingles vaccine is approved for pregnant women.
Okay.
So certainly considering the chickenpox vaccine for women of childbearing age, if they haven't had exposure or the vaccine, is a great kind of preventative strategy. But we do not give the chickenpox vaccine to pregnant women because it's a live vaccine. We don't do any live vaccines for pregnant women because we wouldn't want to accidentally get her sick and then baby sick. So having that chickenpox vaccine before pregnancy or have had an acute infection in childhood is going to give mommy and baby the best protection.
Great. That is great to know. So you did talk about this a little bit, but if you could talk about a little more in depth about what are some of the complications or long-term consequences from shingles?
Yeah, sure. So like one of the things I mentioned was that chronic nerve pain, post-herpetic neuralgia, that can be really debilitating. That's one of them. And one of them too is one of the most serious places you can get shingles is in the dermatome that comes right to the eye. That's really dangerous. And when people have that, your vision is at risk. And actually we typically have, in conjunction with like primary care, we have them see an ophthalmologist like daily or every other day for a while because it's really serious and it absolutely has risk to your vision. So that's one of the strange things of this virus, again, like that it lies dormant in that spinal column and we never know which dermatomal pathway it's going to erupt on. So if you reference that dermatomal map that's in there, you can see how different it follows like the cranial nerves and then where these nerves branch off in between each vertebrae, and there's these very specific pathways that are innervated in the body, and you can see the ones on the head, the ones that go right to the eye. So yeah, so vision loss that's serious, that's scary, right?
And that's potentially permanent.
It can be permanent. Yeah, absolutely.
Okay.
Yeah.
So another question was, where can you get shingles on the body and how serious it can be? And you talked about some of that seriousness, but basically, as long as it's along those nerve pathways, you can get it anywhere on the body.
Yeah, correct. We most often see it on the trunk. That's the most common location for it. It most often is one-sided. I don't know why that is, but it can be on both sides though, or bilateral. But yeah, you can get it on the face, the back. I haven't seen a lot of extremities, but on the buttocks. Oh, if you could imagine, I guess if low down on the buttocks, that poor rash was painful enough on its own, but if it gets down into those sensitive areas, into the groin, that would be even more miserable.
It would seem to be hard to function.
Absolutely.
I know one of our team members, their mother had shingles and it caused lifelong pain. It didn't just end after the shingles rash cleared, but it was something then that she had to deal with that chronic pain for the rest of her life.
Yeah.
So yeah, it can be very serious. And I've known a few people that have had longer term consequences, although maybe not that serious, but that pain can last for a long time, for the rest of their life. So a question came in, do you typically only get shingles once, or can you get shingles twice, assuming you don't get a vaccine?
Great question. So yeah, you can get shingles multiple times. Yeah, when I see people who've had it for the first time, oh, great, this means I can never get it again. I'm like, well, not necessarily. So yes, again, that virus still remains dormant in the spinal column, and later in life, again, like most often during acute illness or stress, it can erupt. So you can get shingles more than once.
Okay. And that can be, again, as your immune system, even if you're vaccinated and your immune system gets weaker as you age, and does the vaccine wear off, so to speak, or it just becomes a little less effective as your immune system becomes more vulnerable?
Yeah, that's a good question. I think a piece of it is just that natural age-related decrease in in function. And again, as we age, we tend to have more kind of chronic comorbid conditions that put us at higher risk for other diseases too. The current recommendations for the shingles vaccine are just the 2-shot series after age 50, and there's not any recommendations for boosters at this point. But as has been my experience with other vaccine, that changes, right? When I see people and talk to them about their vaccines, I'm like, this is what the recommendation is now. That doesn't mean it may change in the future. I'm sure that the data is being collected and watched very carefully. The newer shingles vaccine, I don't know the exact date, but I want to say it's been out maybe the last 8 years is my guess. So it replaced a previous less effective one called Zostavax. And now we have this Shingrix. I still think that probably they're collecting all the data and looking at numbers and following people more long-term as far as their immunity and if they get it. And in the future, maybe there will be a recommendation for a booster dose.
The recommendations for Shingrix have been fairly stable since it came out though, right?
Yes,
there's nothing.
They have, correct. Yeah.
Okay, let's see what's the next question here. You talked a little bit about this, about how shingles is treated once you do get it.
Yeah.
Or if you get it.
Yeah, if you get, if hopefully not once, if you
Right.
get it. Yeah, so the sooner we can initiate treatment, the better. Typically we use an oral antiviral like valacyclovir. There's some other options, and typically it's like a 7-day course of an antiviral to try to help stop that virus from replicating, and it can decrease the course and severity of the illness. We still have the same precautions for the contagion when all that blistering rash is dried up and crusted over. But really, if you look at the dirty details of the recommendations, they recommend that to initiate that antiviral therapy if you're within 72 hours of symptom onset, and that if we're seeing people beyond that, they're already like so far into the course that the antiviral is not necessarily going to be helpful. So I guess that's a good piece of information for people to have, that if they have a terrible, painful, blistering rash, like the sooner they can get seen by a medical provider, the better. So we can start that therapy and help them the best that we're able to.
And really, that's the case with most things, that the earlier you get treated, the better. And if possible, try not to just remedy that at home. There are some things that maybe can, like the next question, and you touched on this already too, is what can you do to make shingles pain more manageable? From what I hear, that there's usually some pain, maybe not everyone experiences that really horrible chronic pain, but there's usually at least some pretty significant pain.
Yeah. Yeah, so generally we try to start with lower intensity medicines like just over the counter acetaminophen, but generally that doesn't cut it. And we have to often treat with, like, for a short time at least, of like opioid type pain medicines. And then for that kind of longer term, that post-herpetic neuralgia or chronic pain, sometimes we employ a different type of pain medicine, something called like gabapentin, which we use for lots of different things, but like other types of chronic nerve pain, like diabetic neuropathy or nerve pain related to low back issues, that sort of a thing.
Because once there's that neuropathic pain, no, I didn't pronounce it correctly, but once there's that level of pain, there's not a lot you can't get rid of it. You just have to manage it at that point, correct?
Yes.
Okay. So again, another urge to get the vaccine and try to prevent it altogether. And thank goodness we have that now. What might trigger shingles? I mean, that you've mentioned several times that the virus lays dormant in your systems. Is there anything that has come up in research that is the top 5 triggers or something like that? Or is it?
Sure. I don't have a top 5, but definitely, I think I made a mention before, sometimes it's during times of acute stress, whether that be emotional or physical stress, or I often see it like while maybe people are sick with some other sort of acute infection. Or the shingles virus is similar to the herpes simplex virus that causes cold sores. So I don't know if people maybe are more familiar with that, but that we see those kind of outbreaks of cold sores, like when they're stressed or they've got a cold or sun exposure. I can't speak to sun exposure being related to shingles, but so yeah, it's typically those type of events. Although I've seen multiple patients in clinic with acute shingles and we can't necessarily identify, oh yeah, I've been really stressed or had some acute illness. It came out of nowhere.
So it's basically those things that can compromise your immune system, and whether it's another disease or illness or even emotional stress. And potentially that's why, though, when you're over 50 and your immune system is starting to weaken, that you're more likely to get it.
Yeah.
Would that be fair to say? Okay.
Absolutely.
So there's another question here in the chat. There's been a link to possibly getting the COVID-19 vaccine and getting shingles. Have you heard of that, or could you speak to that at all?
Sure. I haven't heard of that being a side effect of COVID-19, although certainly
the COVID-19 vaccine.
Yes, sorry, with the COVID-19 vaccine, that piece of it. Yeah. I haven't heard of that as a side effect of the COVID vaccine, but certainly if we think about how vaccines work, right? Like we're exposing our body to these antibodies and then we have this immune response. So possibly as part of that immune response, we were a little bit more vulnerable, and that may have an opportunity for an infection like shingles to present. But certainly it's not a common side effect, or certainly not something I've seen in practice.
Okay, so I did just mention the side effect of the vaccine, but another question came in about that said I got COVID-19, so the actual COVID-19, and then came down with shingles. Might have the COVID-19 made me more susceptible to shingles?
Absolutely. Yep, because that's a big insult to the immune system, so it's already down. So absolutely, that could have been a trigger for shingles.
That seems like a double whammy to somebody that's already down.
Miserable.
I can't even imagine. Just a few more questions here. How long then does it take? You've touched on this a little bit about the blisters, but how long does it take for shingles to clear up, maybe visibly? And then you touched on a little bit possibly the chronic, but how long does it take shingles to clear up?
Sure. So the rash piece of it, that presentation usually clears up within 10 to 14 days. For some people, it's a little bit longer. And that kind of makes me think about another kind of complication of shingles that I didn't touch on is because you have these kind of open blisters and we've got that break in that skin barrier, another complication can be like a secondary bacterial infection in that area. That I've only seen a handful of times, but then that would mean not only are we treating with the antiviral, then we have worrying about it like an antibiotic as well, and that can cause increased pain, fever, so many other side effects.
Oh, yeah, it's practically impossible to keep kids from scratching the chicken pox. So I can see that coming in where you might get a secondary infection and having to deal with both then. And then you have maybe multiple kids at home that are getting it. Yeah. So along with that possible prevention, is there anything that you can do besides the vaccine to prevent chickenpox or shingles? You talked a little bit about staying away from the open blisters, but were there any other thoughts you had on that?
Not really. I think the chickenpox and shingles vaccines are our best lines of defense. And then certainly if we know of any friends or family members or classmates, right, that have acute infection, then just taking those good infection prevention precautions by especially if you know that you have not had chickenpox or the chickenpox vaccine, knowing that bit of information that you're susceptible to, you're at risk of anybody who has chickenpox or acute shingles, but just trying to obviously avoid any compromising situations where you might get into that. So I think just good communication reminds me of the previous webinar, just about having a good conversation about before you're meeting with a group of people. Are they like, how are you good? And I think just being especially cautious of that. If you are old or have an immunocompromising condition, being more aware.
It's one of the few silver linings in the pandemic is that I think we're all more aware of when we have any kind of symptoms to be mindful and stay away from people. Yeah, we can all continue to do that. I don't know if this was covered before or not, if you mentioned it, but can you get the chickenpox vaccine at any age? Let's say if you didn't get chickenpox when you're a kid, is that across ages that you can get the chickenpox vaccine?
That's a great question. I'm not sure what the max age is, if there's specific recommendations in adulthood for that. I would have to look at the CDC guidelines. For the routine immunization schedule, we give it at 12 months and then again at 4 years old. So the idea is to get the kids fully vaccinated before they're in kindergarten. But I think we're in this so the chickenpox vaccine came out in, I think, 1990, right? So we have this, I was already aged out by then, but I had chickenpox. So we have this population from 1990 forward of like grown kids, right? Who didn't have it, probably have had chickenpox. And then we have this other generation where most kids have been vaccinated against it, right? Because we've been routinely immunizing since then. But for people, let's say right now that are like 40, 50 and older, the chickenpox vaccine wasn't available to them. And so it's incredibly likely that they had chickenpox as a child. So actually for the recommendations for the shingles vaccine, if we have an absolute solid knowledge that they never had chickenpox, the shingles vaccine is actually not recommended. So it's bad, but if they don't know, then we give it we give it to save. So, but I think the chances of somebody in their 40s, 50s having never had chickenpox is pretty slim.
And as always, like you said, they can check the CDC website or talk to your primary care provider.
Absolutely.
Yeah. So along that line, then, can you get the shingles vaccine if you've already had shingles?
Absolutely. 100%. So if let's say you had shingles when you were 49. Yeah. I think the current recommendations is you just need to if you just had shingles, you need to be like fully recovered from that acute illness before you would have the shingles vaccine. But yes, like we talked about before, you can get shingles more than once. So getting the vaccine is going to add that extra layer of protection.
So people may think that having shingles once may build your immune system when in fact, no, you can still get it again. And it decreases the likelihood of you getting it again if you get that shingles vaccine.
Exactly.
So, good to know. So if kids get the chickenpox vaccine today, will they, and this is another question that kind of addresses what we've talked about, will they be protected from shingles as an adult?
Yeah.
Or will they still need the shingles vaccine?
Interesting. Really good question. So the chickenpox vaccine that we give is a live virus vaccine. So it means it's like a weakened form of the virus. And if we think about, so then we're just exposing the body to a really weak amount of it, but it is live virus. And again, like I'm not a microbiologist or virologist, so I can't tell you the specifics, but to my knowledge, then you've been exposed to the live virus. So you would have it in your body. So I would expect going forward, these kids from 1990 forward, when they reach 50, that also the shingles vaccine will be recommended for them.
Because that chickenpox vaccine, since it's live, mimics getting chickenpox. So you then have that.
Exactly.
Okay. And then you need the shingles vaccine. You may have touched on this briefly, though. When you get that chickenpox live vaccine, you're not going to get a full-blown episode of chickenpox, but you might you have some side effects that are like chickenpox or a little reduced from a full-blown chickenpox?
I haven't seen any, kind of like we talked about with most vaccinations, when we see an immune response, right? Like with kids, we know sometimes after they get vaccines, they might get a little fever, they might be a little fussy, right? Achy, that kind of a thing. So those kind of side effects are really common, but I've never seen a case of a chickenpox like virus after chickenpox vaccine. It's a really much less virulent dose. Yeah. So not to elicit a full-blown infection.
But people may worry about that when they hear the word live vaccine, but so no presentation of blisters or anything like that.
Not to my knowledge, no.
Okay. Does being immunocompromised then put you at greater risk? You've touched on this a little bit, but are there medications specifically that might make it worse, like that you would be taking if you're immunocompromised? But maybe talk a little bit more about that vulnerability of being immunocompromised too.
So immunocompromised, meaning that your immune system is not working that well. So our normal kind of protective defenses, the white blood cells that fight off infection, don't work as well. And there's some conditions that can cause that. So let's say, I have a great example. I have a patient, a really young 40s, healthy woman, but when she was a teenager, she had mono. And she had a really rare complication that her spleen got so big from the mono that it ruptured. And so she had to have emergency surgery to remove her spleen. And the spleen is actually a really important piece of our immune system. So because she has no spleen, she's considered immunocompromised. And there's something called asplenia, where some people are born without a spleen. So that's another kind of condition that would put your immune system doesn't work as well. So you're at more risk for infections. So there's conditions like that. Certainly people undergoing cancer treatment, just having cancer, period, that's an insult to your immune system. So that's considered an immune compromising condition. And then of course, a lot of the immunotherapy and chemotherapy that we use to treat cancer also is really hard on the immune system. More and more, I see people who have like autoimmune conditions like rheumatoid arthritis, psoriatic arthritis we use several different classes of medications to treat those, but often we use, there's a whole like alphabet soup of abbreviations for those meds that we use, but basically they're like immunomodulators or immunosuppressants in a way, because we are trying to calm down this autoimmune process, meaning that the immune system for some reason is attacking the own body in an inappropriate way. So we're trying to suppress that immune response, which helps treat that disease process and pain and complications, but also then just affects our overall immune response. So medications, Plaquenil, I can't even, all the new names for these ones. I don't know. It's probably all the ones that you see the commercials for all the time.
Right. So a message there is, if you're immunocompromised, you're likely on medication to help you with that, but that could also make you more vulnerable to getting shingles or So again, almost like a double whammy. Along that path of vulnerability and consequences, can shingles, for that matter, chickenpox too, but can shingles be deadly?
Sure. I think that's a pretty rare complication and typically would be in somebody who's the perfect storm of being really immunocompromised, maybe really elderly, and maybe that viral infection not only affecting the dermatome, but if it goes up the meninges into the spinal cord and causing meningitis or infection in the brain. But we typically would only see that with somebody who has a really severe, really elderly or really, really low functioning immune system, and probably lots of other chronic issues. But in short, yes, it could happen.
Especially if you get those, like a couple of those diseases at the same time that just knock you out. I can see where that would increase the likelihood of that serious consequence.
Yeah.
So you mentioned dermatome one more time there, and we had another question in the chat. Can you explain more about the links you put in the chat? So I did put an evaluation link in the chat, but I can include that at the end again. But then also, what is a dermatome, and that diagram that is in the chat? Can you talk about that a little more?
A beautiful picture. I love it. I love it when they're color coded too. It makes it easier to understand. So if you look at that diagram that's in the chat, so there's the front of a human body, the back of a human body, and then there's a picture of our spinal cord, right?
There might
So
be a different
is there
diagram
another
in
one?
the chat. The one was just a diagram, and so we included a link. I
Okay.
don't know if it's color coded, but it's the same back front.
Okay.
I don't know if it has a spinal column.
Sure. So the one I'm looking at has a spinal column, and you can see the spinal cord in the, it's like a side view of the spinal column. So you can see the cord traveling down the middle, and then you see the vertebrae. So, our vertebrae are meant to protect and enclose that spinal cord, right? But there's branches of nerves that come off the spinal cord in between each vertebrae all the way down. And those nerve branches are labeled by which vertebrae it comes out in between. So at the top, we have our cervical vertebrae, that's in the neck area, and that goes C1 to C8. And then in the mid or upper back, that's the thoracic spine, and that's T1 to T12. And then the low back or lumbar spine is L1 to L5. And then we have a couple sacral nerves, S1 to S5. And then if you look on the pictures of the body with the stripes there, that's where each of those labeled nerve branches comes out, the specific areas of the body that are affected. To give an example, if anybody's ever known somebody or had like a pinched nerve in their neck, right? Maybe, or in their leg, right? Sciatica, a lot of people probably heard about sciatica. So that's where like one of those nerves that come out in the lumbar region, they get a little irritated or pinched by like a bulging disc. And then they've got back pain, but then they have this nerve pain that radiates all the way down the side of their leg, even sometimes into their toes. So that's that dermatomal pattern, right? Like that. So it's similar how shingles follows that. And if they've got that rash, it generally follows one of those truncal ones in that same sort of pattern.
Those are excellent examples. I think many of us have heard of sciatica or some of those other things, and to then, yes, put that together. You can have it radiates out from the body, and that term is great to explain that. So a couple more questions from the chat. And I got shingles 9 months ago, and the rash is gone, but I still have pain that comes and goes. How long will it take for that pain to go away? Done that a little bit.
I know. Yeah. If only I had a solid answer for that. Yeah. Like when I talked about that post-herpetic neuralgia, we talked about that it can last for months, but for some people it's years. And for some, like you mentioned, one of your coworkers whose mom had that, it followed her to the end of her life. It's really hard to predict for one individual what their experience is going to be.
Yeah, and just to be clear, it's not like a stub your toe kind of pain. It's a nerve pain that can last, like you said, for the rest of your life.
Yeah.
Again, a couple more questions. My child was exposed to chickenpox. Should I keep them home?
Great question. And again, that's going to go back to, have they been immunized? Like, how old are they? What are their medical issues? But also, have they been immunized? So if you have a baby under 12 months old who's not been immunized and they've been exposed, you need to closely monitor. And then if they certainly have any signs or symptoms, then definitely keep them home or get them assessed by a medical provider. But if your kiddo's fully vaccinated, you can feel pretty confident that you don't have to keep them home. It's certainly monitor for symptoms too, but they are very well protected.
Great. That's good to know. And then, is the chickenpox vaccine the same kind of vaccine? So same type of vaccine as the COVID-19 one?
Okay. Yeah. Good question. No, it's not. Like I touched on before, the chickenpox vaccine is a live virus vaccine. And answering the question about the COVID-19 vaccine, we have there's several different options for the COVID vaccine now. So the Moderna and Pfizer are an mRNA vaccine, which is a newer technology that actually was already in development for the annual flu shot before the pandemic hit. And that's part of the reason why they were able to really ramp up the research and get that churned out so quickly, is because we already had research in place for that. And then subsequently, there's the J, and then there's also Vax, I think, is the fourth option here in the US that came out most recently. That it's not a live virus vaccine, but it was developed a little more traditionally, like in the same way that the hepatitis B vaccine was. So it's not an mRNA vaccine. So good question. Yeah, there's several different methods for how they create vaccines.
I think the origin or type of vaccines have come a lot more into the light since COVID. And so people are asking those kinds of questions about what type. Then one of the last couple questions, where can I get the chickenpox and shingles vaccines? And do you know if most insurance companies cover those or if they're expensive if they don't?
Yeah, that's a really great question. So for chickenpox vaccines, like I mentioned, that's part of our kind of routine childhood immunization schedule. And most primary care offices keep those in stock. Health departments, actually a lot of most pharmacies don't tend to do the childhood vaccinations. So typically it's a primary care office or health department that's doing those. And chickenpox vaccine is really well covered. So for children that have commercial insurance, it absolutely is covered as part of preventative care. For kids with Medicaid here in Michigan, we have a program called Vaccines for Children to make sure that all kids get all their routine immunizations at no cost. So talking to if you have a primary care or pediatrician, you can get all your kiddos vaccines done there. The shingles vaccine, as far as cost and coverage, is a little bit more complicated. I have a lot of chats with my patients about that. So, the age 50 and up is generally who I'm giving it to. And so I have a lot of people in their 50s to 60s that are on commercial insurance still. And then, of course, I have my patients at 65 and older or with some other issues that have Medicare. So Medicare won't actually pay for the shingles vaccine in a provider office, covered as part of their Part D or drug plan. So you actually get it at a pharmacy. And pharmacies they're an awesome resource for vaccine. I actually was just looking up for somebody the other day at their local pharmacy because I was advising them on the hepatitis B vaccine recommendations. And I looked up this local Meijer and the list of vaccines they have available. It seems like it's a mile long. It's great. So I think a lot of people, and maybe that's one of those things that's come because of the COVID pandemic too, is, oh, wait, like I can go to the pharmacy to get a vaccine. I think that's become a lot more popular. Have you heard that?
Yeah, I think that is something newer. I'm a little bit older. I'm at the age of getting shingles, and I used to never think of going to the pharmacy to get a vaccine. But now, of course, we all have probably in one way or another.
Yeah. So for Medicare patients, again, the local pharmacy, because it's covered under their Part D or drug plan. For commercial insurance, I have found that it varies. So typically for people that have commercial insurance, if they are here in the office and they really want it, I would say, pull out your card and call your customer service right now to find out for sure if they'll pay for it here. Because if they don't, it's like upwards of $300 a pop. And I certainly don't want people to have that bill coming to them. So for some commercial insurances, they will cover it in the office, and some, again, it would be the pharmacy setting. The nice thing about the pharmacy too is you can always ask your pharmacist. They can pull up your coverage and they can tell you right there if it's covered and what your copay would be. So that's a great resource for that too.
Yeah, that's exactly what happened to me. That's what made me think, oh, this must be an issue. It must not be covered, because when I went, they said, let me pull up your insurance. And they told me right away that it was, fortunately, that it was covered for me.
Exactly.
So,
and then for my adults that have Medicaid, at least the Medicaid programs that I see here in the office, it's fully covered here at a doctor's office. And I suppose that would be available at the health department as well, although we don't do quite as many adult immunizations at the health department.
So that does seem a little more complicated for the shingles, but it does sound like you probably can find some way, hopefully, to get it covered. You may just have to look into it a little more than like the chickenpox vaccine.
Exactly. So. Yeah. And I find that people are typically pretty grateful if you have that conversation about the cost ahead of time. Here's why I want you to know if we give it to you today and you get this bill. And then I believe that the manufacturer for the shingles vaccine also has like a financial assistance program. So if you fall in like an uninsured category, or let's say for some reason your commercial insurance does not cover it, there are some additional resources through them to be help for cost and coverage on that.
That is really good to know. Very good to know. So one final question as we wrap up. If you, Katie, if you had some final key take-home point you wanted to make, what would they be? So anything maybe we haven't covered, or encouraging people in any way?
Yeah. And we covered a lot. We covered a lot of ground here today. So I think we did a good job of kind of giving like just a synopsis, a little bit of like chickenpox and how that's related to shingles. So I think just for people to understand at the very basic level how those two things are connected, and then understanding that shingles is a re-eruption of that virus later in life. I think that just having that knowledge, I think knowing about the safety and efficacy of both the chickenpox and the shingles vaccine, they're very efficacious and very safe. And again, kind of like we talked about, that the benefit certainly outweighs the risk, as with any vaccine, right? That's why we do extensive research on safety, right? Is that we're trying to offload some of that risk and lost pain and lost time and complications, all those things. I guess my other piece of advice with shingles too is just, if you think you might have shingles, get seen right away, because time's important, right, for treatment on that. So that's really good for people to know. And then just making sure you're having just circle back to that question about somebody who had a physical and they were 50 and their provider never brought up immunizations. But I just be a well-informed user of healthcare, right? And ask. Don't be afraid to ask. One, hey, we haven't talked about vaccines in a while. Is there anything that I should consider? Or just bring your specific questions about the Shingrix to your provider, and especially about cost too, right? But knowing that there's workarounds and lots of resources for that.
Sometimes it just seems like it takes a lot to stay ahead of everything, but advocating for yourself is so important, and that immediate care is care as soon as possible, so you can hopefully prevent some of those long-term kind of consequences that you might be. Thank you. This has been such an eye-opener. I learned quite a bit myself, and it's just been a great time to chat with you about this topic. If I am going to put the link to the survey in the chat one more time, so I encourage you to complete that, and we'll stay on here a few minutes for you to be able to do that. So thank you again for everybody. Again, I'll keep this open for a few minutes, but thank you, Katie, so much for all of the information you continue to provide to our audience.
Absolutely. Glad to do it. Thank you so much.
Thank you.
Okay.